the Secretary to the Government of the Federation, honorable ministers here present, Director General, directors, ladies and gentlemen. The number of confirmed COVID-19 cases in Nigeria has continued to rise, not unexpectedly, in view of prevailing circumstances in certain states of Nigeria. As at midnight yesterday, the 5th of May, 148 persons had tested positive, bringing the total to 2,950. 481 persons have been discharged, and 98 COVID-19 related fatalities have sadly been recorded. The 148 new cases were reported in 17 states as follows: 43 in Lagos, 32 in Kano, 9 in Katsina, 10 in the Federal Capital Territory, 14 in Zamfara, 7 in Taraba, 7 in Borno, 6 in Ogun, 5 in Oyo, 3 in Bauchi, 3 in Edo, 3 in Kaduna, 2 in Adamawa, 2 in Gombe, 2 in Plateau, 1 each in Sokoto and Kebbi. We are clearly in community transmission phase, where much now depends on individual and collective behavior, and the urgency of behavior change communication becomes apparent. Knowledge so far gathered about COVID-19 needs to be converted into practice, because our safety, now more than ever, depends on all of us. We are to adhere to public health advisories, the wearing of our masks, observing social distancing, practicing hand washing or sanitizing, standard respiratory hygiene, avoiding crowded places, and also avoiding all manner to a good understanding of the urgency of this situation. Much progress has been made in collaboration efforts with the State Ministry of Health and the EOC to restore routine medical services to hospitals, to improve the confidence of the doctors and health workers, and to further drive the ongoing investigations in the state. Organized ambulance service is already in operation, bringing relief to citizens who need to access medical service, especially at odd hours and in view of restrictions of movement, and also in emergency situations. The Federal Ministry of Health is sending supporting teams to Sokoto, Katsina for training, capacity building in case management and infection prevention and control in a hospital setting. Other states shall follow at short interval to assist the state ministries of health of these infectious materials. Measures. I remind everyone that this is even more critical to movement in relax. The value of the tentative easing of the lockdown, which was announced by His Excellency the President, depends on population adherence. I urge all citizens to practice and use various media options available to them to propagate and support the guidelines issued by the PTF. We again recognize our frontline and backroom healthcare workers, the caregivers, hygienists, security, drivers, porters, and others for their tireless efforts to continue to adhere to self-protection regulations. I also thank all those citizens who adhere to infection prevention and control and non-pharmaceutical intervention advisories, and urge you all to propagate it to your neighbors. Thank you for listening.